one of the things that we notice also, a part of the operation challenges, is how to collect this cord blood and cord tissue in a very high standard way. So we believe that we really need to provide delivery nurses and the gynecologist doctors on the right way of how to collect these stem cells. That's why we are focusing, before we collect these cells from the hospitals, we are focusing on providing a full workshop on training the gynecologists and nurses on the golden steps on how to collect this cord blood. Because it's a very simple procedure, yes, but it needs a very high quality standard to follow. For example, when I transport this cord blood and cord tissue from the hospital to the lab, which environment should be transported? What are the transporting material need to be there? What are the solution need to be, put in within this cord blood and cord tissue to be able to make sure that they are staying in very high quality? And then when we are collecting it in the delivery, what kind of disinfecting procedure we need to do? How do we keep this cord in very hygiene environment? What are the steps of collecting it to make sure that all the blood is withdrawn from the cord into the collection bag with a very enough amount that it can be really saving the patient the amount that is needed. So I always focus on providing as much as possible training workshops for the nurses and gynecologists. First, we educate them about how important the stem cells, what are the different sources of the stem cells, why we need to focus nowadays on stem cells. They are the future medicine, and they are the future actually of healing many diseases and treating many diseases. And then the practical part of it, how do we collect it? How do we maintain it in a good temperature? How we deliver it to the lab? And how we isolate it and keep it in a good condition before it goes into final product, which is inside the liquid nitrogen tanks for 30 years.